Hey folks, it's Paul Essery here. I'm delighted today to be with Annie Haykuni from Vann. Annie, thank you for taking a bit of time out to come and have a chat with me. I know you're, like every CEO I know, you've got plenty to keep you busy. So, and I appreciate you taking a bit of time out to come and have a chat with us. So, just for the people that might be listening, tell us a little bit about yourself and a little bit about the business, and then we'll talk about the kind of technology and the other parts after that.
Thanks very much, Paul, for inviting me, for having me on your show. And so my name is Ani Haikuni, and I am the founder and CEO of Vann. It's a digital health company based in Oxford. I'm a mechanical engineer by training, so I do have training in mechanical engineering, forestry, natural resource management, policy from State University of New York and Syracuse University, and I do have a business degree from Oxford University, Said Business School. And I've had the privilege of working with international organizations such as United Nations, UNIDO, it's the Industrial Development Organization, World Wildlife Fund, CNF, SUNY Research Foundation, and private companies. And I did advise, provide support to the private companies on sustainable development and environmental impact. So in 2015, I had my diagnosis of late stage breast cancer, and I had recurrence in 2019. So for about 8 years, I would say more than 8 years, I've been involved in healthcare
Mm.
and learning about cancer and dealing with this disease, being on treatment myself and helping other people who've been affected by cancer. And I actually realized that there is so much that we don't know about this disease, and there are so many issues and problems that people affected by cancer and their families are going through. And I, before my diagnosis, I, there was times when I asked a lot of questions. One of them, of course, was about my mission, like why, like what's my mission?
Mm.
I did have a good job. I worked on very good projects and income and so on, but something was missing. And I was doing a lot of hiking. I used to paint. I like music very much. But after my diagnosis, when I realized that, look, I think I was sure that my mission was to help those people who've been affected by cancer and also help find answers to questions about this disease, because I do have a lot of questions and I know that others have
Mm.
those questions as well. And in 2019, when I had recurrence cancer diagnosis. The cancer diagnosis was the same, breast cancer. So I decided to develop a company around the idea that I had before and help and support millions of people affected by cancer. I wanted to start this movement and help research, because I do believe we can make a change if we are united and if we really come together and share our experiences and help find find answers to all these questions that bothers all of us. And I do also have a charity. It's called Ani Haikuni Cancer Treatment Support Foundation, which
Mm.
supports people from low-income families.
Okay. And of course, cancer is going to affect 50% of the population, isn't it? One in two people are projected to get it at some
Yes,
point. So it's an
yes,
issue for everybody. Everybody's either going to get it or they're going to know people that's got it, haven't they? So it's
yeah,
everyone's
and
interested to do something about it.
indeed, and yeah, and number of cancer cases are increasing. So it's younger people are getting young people are getting cancer more and more, and that's something that is really worrying.
Sure. So I mean, okay, I get why you've created Van. You know, tell us about tell us a bit more about what it does. I mean, tell us a little bit about the technology, but more importantly, what is it that your business does that people perhaps couldn't have done previously or can now do better? I mean, tell us about the impact of the technology and what you're trying to do with it and how that would make people's lives better.
So Van has been created around, you know, the kind of the mission of the company is very much to fill in the information gap about cancer, is by helping and contributing to research. So and providing the support that people affected by cancer need. So we have developed a platform. It's a mobile app and the web app, which uses holistic approach. So it provides holistic solution, and we are considering the needs of cancer patients right from the the first day of their diagnosis till they are on remission. So we do provide tools that are gonna provide the most important information based on the needs and issues that patients have raised, including myself. So, for instance, what treatments they are going to get, how to find those treatments, what side effects they are going to get from particular treatments, how to find clinical trials, what advice that they can get based on their case. We do have surveys, and we invite people to take part in our surveys and share their experiences. And as soon as they share their experience through the surveys, they get instant feedback. I mean, instant data on the dashboard. We do bring the general public, regardless, like people, regardless of their health issue. This could be a completely healthy people. We invite them to come and motivate those affected by cancer through, for instance, through the Make Smile tool. And so our goal is to, first of all, to provide that support that people affected by cancer need and unite millions of people from around the world. And through research, through contributing to research, help answer questions about this disease, like, for instance, why some people do experience recurrence, do have recurrence, some people don't. Why people like me who had a healthy lifestyle, suddenly she gets late stage breast cancer. I didn't smoke, I didn't really, I didn't drink, I was in sport. So those are the questions that we should certainly, you know, try to get a very good idea about before we can move ahead and compare it with other companies and other solutions that have been in the market so far. And I can say that as a, you know, as a patient myself, there wasn't a solution that a product, including an app or a web or any other solution, in reference to the product that we have that we have developed. They do either offer a community where I could just go and talk with other people, or they offer just a symptom tracking tools where I could track my symptoms and then see how what my information, what my data was. And coming from the patient perspective, I can say that, and I can say that on behalf of a lot of people, the majority of people that I have interacted with, we spend so much time in the hospital, in hospital setting, in appointments and conversations about this disease. We really want to take some time off and be in an environment, in a community where it's safe, there is positive, there is hope, there is something is different, the approach is different, and it doesn't remind us about our disease that often. And that's what we have created with Vann. Vann is a safe and unique environment and positive environment where people can just go and spend even a
And
couple of minutes.
I mean, just at a very practical level, I mean, what sort of numbers of people have you got? You know, because I can obviously see why, if you're struggling with cancer, you'd want to join a community like that. I mean, I completely get that. What sort of number? I mean, what's the reaction been of people to this? I mean, have they reacted positively? Have you got lots of people involved? I mean, tell us a bit about the practicalities of it.
Yeah. So currently in our platform, we don't offer interaction, like the community interaction. So the
Right.
people can't really talk with each other. Currently in this version of the platform, the only way that people can interact is through sending gifts. So for instance, if I I go for a run, I can dedicate my run to someone affected by cancer, and I can send that gift, like I can send that message saying, I can send a message saying, hey, I'm doing this run for you. I hope you feel better soon. Look, don't give up. Life is can be tough sometimes, but hey, we're here for you. I've done this hike for you, even if you don't know me. It's just a form of, like, it's a nice message. It's a nice way to show your support,
Yeah.
even if it's just a small gift. It's a free gift, and the person who receives that gift, it it makes them really well, feel really good,
Yeah.
even if, again, it can be a small thing. And we've tested that. We have involved people who used that tool, who received, who were, on both parts of the on both sides of that platform. So we've received very good feedback from people,
Mm.
and including also the, like, in terms of other tools that people have used. I did say that in terms of the user experience, in terms of the, even the design, or in terms of the tools that we provide, it's quite unique. So we've done a soft launch. We haven't done a marketing, or we
Okay.
haven't really
You're at
paid
fairly
an
early
ad.
stage still.
Yeah, we are early stage, and now we are in the phase of really learning and getting the feedback from our users. I can say that we do have a active base of good number of active users who use our app on a monthly basis, and those are the people who really love our product. So now the next step for us is going to be to, based on the experience that we've got, to expand
Yeah.
the scope,
Yeah.
and to involve more people from,
Yeah. I mean, I love the idea of the proposition of sending those little bits of support and, care to people that are struggling. I mean, it's just because they can, a little gesture of kindness can often have quite a big impact, can't it? So
indeed.
I love the
Yes.
proposition. I mean, I think it's a great proposition, but I mean, you've been at this for a while, and it can't have been an easy journey. I mean, tell us about some of the challenges that you've had to deal with. I mean, you've got a great proposition. It's all about helping people, and a large number of people, could benefit from it. Tell us about the sort of journey to where you've got to now, and some of the challenges that you've had to deal with, because I get the impression it can't have been that easy.
Well, it can't. Well, certainly it isn't easy, but the whole, this company development, the startup development process, the whole journey is full of very exciting things,
Mm.
rewarding and interesting stuff and fun, but in the meantime, tough decisions and challenges, right? So it's, uh, if if you decide to build a company, that's what you need to face. And I, as a founder, and also my team, so we're quite aware of it. In terms of the challenges, what challenges we have overcome, uh, I would say, look, it certainly been an educational process, it's been an educational journey. I wouldn't emphasize any particular challenge. Uh, I would say that this just whatever we've done, whatever we've overcome, it's been part of this uh, whole experience. One thing I would like, certainly, share as a founder, it's very, very important for the founder, for the entrepreneur, to grow with the company and really stay committed, and whatever happens, the entrepreneur will need to stay focused, be flexible, like take the feedback and be flexible, and be aware of the kind of the stuff that is happening for the company. But there are going to be times when, especially when the company grows, and when the entrepreneur and when the founder grows, and the team as well, the type of people, or I would say the skill set,
Mm.
the skills and experience that the company is going to need from other people, that's going to change. So there's going to be need to invite, the people who are going to have the knowledge and experience that are going to be necessary for the company to grow. I think um, that's super, super important.
Yeah. Okay. Well, I mean, well done on getting as far as you've got, really. I mean, like I said, I mean, it doesn't seem to me to have been, it seems to me to have been quite a difficult journey. So well done on getting to where you've got to. Tell us
Thank
about
you.
the future. I mean, like I said, I think it's a great proposition, and it could be very valuable to a very large number of people. So, I mean, in terms of, let's say medium to long term, 5 to 10 years out, what sort of impact do you want to have? What is it you want to achieve? What are your ambitions for the business going forward?
Well, I certainly wish for Vann, I really want Vann to be the number one tool for everyone affected by cancer. Whoever gets this diagnosis, I want people to say, "Hey, look, we know there is a good platform, there is a good tool. You should give it a try." It should be Vann. I would like Vann to be the first tool again, not because it's my company and I really want it to be the first and the only one. Of course, that's the ambition, but because the solution that we're providing, what the potential that this product has and it can have in the future, I do believe that it's going to change a lot of lives. And in addition to just building, in addition to building a for-profit company or building a solution, building a product, um, I want to see a time in the future, and probably that's going to be a long term, where Vann is going to be going to be one of those players that's gonna help find, as I said, answers to very, very important questions,
Mm.
and that will help us understand this disease and prevent and save lives, first of all.
Mm.
And millions of people, like in terms of the impact, millions of people and their families to use and to use this platform and just kind of feel inspired and
Yeah.
feel get this different approach that we are actually providing. That's what I really want to see and in the future, because, and also, well, yeah, I can say based on my personal experience, my story as a cancer patient and a two-time cancer survivor and a patient advocate, and in the past as well, I had received very attention from thousands of people from around the world, and I came to understand that the story my story resonated with so many people, and it helped them. The story helped people to kind of think even for a couple of minutes that, hey, look, I know that I am on this very difficult treatment, but I know the story. I know Ani has recovered. Ani has gone through so many things, and I believe in my recovery as well. I think it's about the message as well, like what message we really communicate, what really communicate with our users and potential users and communities.
Yeah. And we know that what people believe has a tremendous effect on what happens, doesn't it? You know,
Indeed.
we know about that. That's what the placebo effect is, isn't it? If people believe they're going to get better, they often do.
Yes.
We don't know how it works necessarily, but we know it happens. So I mean, it seems to me that it's a great proposition because you're helping people in a difficult situation feel better and hopefully make progress, and potentially you're going to help make progress towards a cure. I mean, what's not to love? I mean, it seems to me it'd be a great proposition. I mean,
Thank you.
so I mean, like I say, good luck with it, and
Thank you
it's
very much.
I get that it's a difficult place to be, difficult place to work in, but it could have tremendous benefits. So it seems to me it'd be a good thing that you're doing. So well done on that, and good luck going forward. And I mean, I really hope it's a success. I mean, like I said, because we all will either get cancer or know people that have had cancer. So it's something for everyone to think about and for everyone to pay attention to. So, like I say, good luck.
Thank you very much.
Thanks for
Thank you
coming
for
on. Cheers, Annie.
thanks for the invitation. Thanks.
Bye bye.